According to the Centers for Disease Control and Prevention, the prevalence of obesity for children and adolescents aged 2 to 19 was 18.5% in 2018. Over 13.7 million children are affected by this epidemic. Childhood obesity is a serious risk in the United States. Those who are obese are more likely to face serious health problems throughout their entire lives. Childhood obesity is more common among certain populations, specifically Hispanic and African American children. There is a correlation between socioeconomic status and obesity as well. Low-income groups have the highest prevalence of child and adolescent obesity. Obesity is a serious health condition and can lead to not only chronic health diseases, but it also affects mental health. Obese children are often teased and bullied, leading to isolation, depression, and low self-esteem. In addition, these children are more likely to develop asthma, sleep apnea, type 2 diabetes, and in adulthood, heart disease and cancer. It is incredibly important that we begin to make small changes to help combat the obesity epidemic facing the United States. While there have been many preventative programs to educate parents and their children, there need to be larger movements to educate families and children about living a healthy and active lifestyle, in addition to efforts that try to limit consumption of high-fat and high-sugar diets. In particular, healthy foods need to be more accessible in addition to being advertised and promoted. As stated by Chris Madsen, an associate professor of public health at the University of California, Berkeley, sugary drinks are a menace to society and a direct cause of obesity. Berkeley was the first city in America to tax sugar-sweetened beverages. Over the first 3 years, they saw a 52% decline in consumption. A soda tax has been implemented in larger cities as well, one being Philadelphia. According to Anna Touchman, a professor from Northwestern University, the sales of sugar-sweetened drinks dropped sharply in Philadelphia, but the sales of soda and other taxed products increased dramatically in stores located 1 to 4 miles outside of the city. Although there are ways to get around such taxation efforts, it is still an effective way to limit the intake of unhealthy foods. Even after considering the purchase of taxed foods outside of Philadelphia where they are cheaper, the city still saw a 20% decline in consumption. Because childhood obesity is most common in low-income families, an increased price in unhealthy foods would therefore limit the number of purchases a family could make. Not only is it important to limit the unhealthy intake of foods, it is necessary to make fruits and vegetables as well as fresh produce easily available and accessible to all Americans. According to a 2014 study regarding the relationship between obesity and socioeconomic status and how it correlates with the availability of healthy food options, offering better prices for healthy foods related to junk foods, actively marketing healthy foods, and enabling consumers to resist the influence of junk food marketing are the most effective strategies to help fight childhood obesity. Food deserts are a common place where childhood obesity is prevalent. A food desert, as defined by the American Nutrition Association, are parts of the country vapid of fresh fruit, vegetables, and other healthful whole foods, usually in impoverished areas, largely due to a lack of grocery stores, farmers markets, and healthy food providers. Because of the lack of accessible fresh produce and healthy food options, those living in food deserts are limited in what they can buy for their families. If all parents are able to afford or have access to fast food, they are increasing the likelihood for obesity in their children. According to an article from Healthline, a 2014 study examined the impact of opening a new grocery store in a Philadelphia community considered to be a food desert. The study revealed that there were only small changes to BMI and only minor improvements to the consumption of fresh fruits and vegetables. The reason being that the new healthy food options were not being promoted or advertised. Many informational nutrition programs have been implemented throughout the country to educate children about healthy eating and to promote an active lifestyle. I believe that along with the soda tax and more access to healthy food choices and increase in educational nutrition programs for young children will lead to a decrease in childhood obesity rates. In conclusion, children need to be taught information about a healthy lifestyle from a young age and need to know the importance of being active and careful about their eating. Without proper information, children will not know the negative effects of unhealthy food and how it will impact them throughout their entire life. As stated by Livestrong.com, these programs teach kids the difference between healthy and unhealthy, reduce fast food consumption, encourage physical activity, and increase fruit and vegetable intake. If such programs could be made mandatory in elementary and middle schools, a multitude of children would have a greater understanding of the importance of a healthy lifestyle. The education and promotion of healthy living, especially in areas such as low-income neighborhoods where childhood obesity is most prevalent, would be effective in helping fight against the obesity epidemic facing America's youth.